hopefully colleagues can see a PowerPoint slide on their screens. So thank you very much for your warm welcome, Luna, and it's great to have the opportunity to say good evening from Beijing and to extend our lives by saying good afternoon at the same time. As Luna has explained, I'm going to present a paper which is largely Lichao's work. And so in that sense, it's been somewhat of a voyage of discovery in terms of thinking precisely how to express the thoughts that Lichao has. We will order our talk really by introducing a little bit of what's happening in China to set the scene, and then go on a journey which begins with stigma, which is where we're asked to focus on, to think about stigma and health, and to think about its manifestations in China, first of all, and then more globally as we think about the implications of COVID-19 for us all. So let's begin by setting things in context. I spoke back in the end of last year at a meeting in Exeter, at which point that list was very different. It had United Kingdom in position number 2. The world has moved on. It's still a horrible chart, which records the number of deaths per million. And as we can see, the United Kingdom is at number 15. The situation is very different, of course, in China. COVID probably began in China, and it peaked in February, specifically on the 15th, 2020, at which point we had something like 60,000 people who were experiencing COVID out of a population of 1.4 billion. By April, the epidemic was effectively over. That was the last time there were more than 1,000 active cases of COVID in the country. And the overall death rate is about 3.5 per million, compared with nearly 2,000 in the UK. I almost said here in the UK, I'm not quite sure where I am. We might not believe the Chinese figures, but I can pretty much assure you that it's very rare to hear of anyone catching COVID. And I've visited many hospitals in the last few months, and life is pretty much normal. So that means that we're going to be talking about COVID and how it's impacted on stigma in a concentrated period of time, a period of time which coincided with a disease which we weren't sure what it was. So it was that situation where we were learning very rapidly, as it turned out. But it has had much more longer term ramifications. Now I'm asked to talk about stigma in relation to COVID, and when you talk about stigma, most of us go back to the classic work of Goffman back in 1963. And essentially stigma is about being a person, well, not quite being a person. It's about someone who is not accepted as quite human for many reasons. Essentially, stigma is a social process. It's a process by which one group stigmatizes essentially another. Goffman focused very much on physical aspects of the body, but also blemishes in character. And also, as he talks about, tribal stigma of race, nation, and religion, and all in rather dated language. Things have changed, or our way that we speak about things has changed pretty significantly in the 60 years since his important work. Essentially, though, it's about somebody who doesn't live up to a social idea, who doesn't do the sorts of things that are expected of isn't as one would expect them to be. And we are making judgments of people who are being stigmatized, the us and the them. And those judgments are nominally based on our understanding of the other. Now, how do we know about other people? Well, we have some sorts of global ideas. And Brewer, who thought about this, was very much thinking of the stigmatizers who look at another group and think about the characteristics of the group and think about slotting somebody into that group, knowing what the group is like and inferring from whatever evidence they can find that that person fits the group. And once that person is within the group, often the other group then rather than us, a whole series of things are assumed about them. So in other words, we're in the world of stereotyping. We categorize people into groups in terms of global group characteristics and then assume individual features about them. And those things are, in the context of stigma, very largely negative. So we are normal, those who are stigmatized are different. And in practical terms, it seems that manifestations of stigma are very closely linked with the behaviour of us, the stigmatizers, where it intersects with notions of prejudice and of discrimination, and of course, of labelling. I will, to some extent, contrast stigma with shame a little bit later, but let's work with stigma, and let's follow an understanding as laid out by Goffman and Brewer, and switch into the context of China. Now, my Mandarin is non-existent. Lichao will no doubt chuckle as I start to pronounce even one character. But the traditional form of Chinese for stigma is ru. And that equivalates, or a straight description, is a link directly to sewage. So stigma and something disgusting go very much together. In the Japanese, same character, different pronunciation. The link across the interpretation is one of dirtiness. In simplified, i.e. in modern Mandarin, it's wu ming, which in a sense is the name of sewage. It's the application of that to somebody. It's very graphic in terms of what stigma therefore means in a Chinese context. And as you can see, dirt and sewage have got some degree of connections with public health. Work, and here I hesitate because I know I'm surrounded by health experts who've thought a while about the connections between stigma and disease and illness. But it's sort of social categories which come to mind as we categorize people relate to disability, mental health, and sexually transmitted diseases. Certainly, those are the divisions of thinking within a Chinese context that might link you to stigma. There's also fear, high fatality rates, and cancer, that unknown, that thing that can affect us that looks like a death sentence, is also a disease that's highly stigmatized, as are infectious diseases, which pose significant health risks to others. Leprosy historically has been the sort of ideal type in relation to thinking about disease and stigma in the context of China. And again, diseases associated with social minorities, another form of other. So the stigma relating to disease connects with discrimination in relation to social minorities. But of course, context is important, and context changes over time. And it's quite interesting to think about TB in that context, because in some senses, TB has been associated with the affluent. It's been associated with the beautiful, the artist. In some respects, historically, there's a really interesting sort of connection between body image, TB, anorexia, and status. That they work the opposite way round from the normal stigmatizing labels. And we find that in China too, historically. So at the turn of the last century, the Lady of the Camellias was translated by Lichao. You remember the story that found its way into La Traviata, into Verdi's opera? The notion of the courtesan who falls in love, and where that love is reciprocated. But for the sake of the family name, the woman Marguerite leaves, denies her love, and laments that love through the experience of TB and tuberculosis. And in that sense, the connection between the heroic or the heroine, in a sense, love, sickness, and TB equate together in that novel. Later in the 1930s, we find again in Chinese literature, Ding Ling's famous book, translated into English many times, in fact, The Diary of Miss Sophie. Sophie is a modern Chinese woman. 1930s was very much China looking outwards. She was of that sort. She was in some senses bohemian. She too fell in love, but it was less the love than the alienation with the society around her. She lived a bohemian life. She was poor. She couldn't actually fulfill the aspirations that she wanted to aspire to. And so TB in this case becomes a manifestation of alienation, if you like, from a sort of positive to a sort of negative. And there's a sense in which the growing acceptance of germ theory helped stigmatize TB. TB now became something that you could catch. It was something that was increasingly associated with poverty, with ugliness, with the filthy and the poor. And so this context of disease is clearly rather important. So how does this all fit together and connect to COVID-19, which is still largely called coronavirus in China, the crown disease, the crown virus. And there's a series of stages, I think, that we need to work our way through to begin to organize our thoughts about what the connection is between COVID-19 and shame and stigma. Process of recognizing the symptoms, first of all, and naming the disease, and then a process of what's the source of it. And we have here a photograph of course, the Hunan seafood market, which was thought to be the source of the epidemic in the early days. And then the transmission pathway, this real discussion about whether it really could travel human to human. And we still have an ongoing debate about when China knew and when the world was told about that. Issues about how we can prevent it. We have no obvious form of treatment in January and February next year, so it has to be public health. How do we diagnose it? We got to diagnosis very early. I wrote in a very early paper, I'm not really sure whether it's true, that China was able to identify the virus because it universally takes blood tests whenever you go to a hospital. And you go to a hospital in China because you've got a cold. There is no GP system to act to triage cases. You all arrive, you all get tested. And then, of course, there's a discussion about what the appropriate treatment is. And then when you know how it spreads or that it does spread, then becomes questions about blame. Who is responsible? Who's responsible for the spread of it? How do we control it? Is it us, the government, or is it as individuals? Is there a social role, social function? And what about those who catch it? Are they patients or are they evil? Should they be stigmatized for reasons of behaviour? So let's think about some of those aspects, some of those steps as we begin to understand what happened in China. WeChat is the universal form of social communication in China. We all use it. We pay our bills, we live our lives, we have our health records, and we talk. And doctors at the end of December 2019 were talking about the seafood market and about the fact that cases were turning up. Didn't get very far, they didn't broadcast, it was WeChat, it was to their friendship groups. Internationally, of course, social media has been fundamentally important in moving on from what is it to who should we blame and why should we blame. It's very difficult in Western media now to find all the Chinese stereotyping that was done, the yellow peril that had turned itself into a rampant disease. We can find traces of it in terms of people responding, which have been selectively kept. It's quite interesting how Twitter seems to work. It's kept the positive, and it somehow seems to have lost the negative. So here's somebody talking about attacking Chinese people for the exotic meat. Is shocking in its ignorance of the history. It's actually nothing to do with China. It's entirely how industrialized food production monopolizes the public consciousness of food in America. So food comes in plastic packages in America, has nothing to do with live animals. It's a discussion and debate which went on, but receded by this notion of the Chinese eat anything. And this is made much more explicit in some of the high status tweets we can find. So Republican Senator John Cornyn, China is to blame because the culture is where they eat bats and snakes and dogs and things. That's why China was the source of lots of viruses like SARS and MERS and swine flu. Well, MERS is Middle Eastern, that's where we think it actually began, and swine flu, best guess is the United States. So we're combining ignorance of many sorts in terms of the tweets, which shaped a global response to COVID-19. Tabloid newspapers, Mail Online is classic revolting footage showing Chinese women eating a whole bat. There you are if you can stand it. It is disgusting. But of course it was not just the British media, it was not just the classic Western media. Here's a tabloid from India, or is it Pakistan? From Pakistan, I apologise. Celebrity. The batsman who knows, the batsman who promotes. Why do you eat bats and cats and things? When God has given you so much livestock, why can't you eat that? Why do you have to eat bats and cats and dogs and drink their urine, their blood, and spread the virus to the entire world? I don't understand. I'm really angry. I'm pretty ignorant as well, but ignorance and anger can go together, of course. And so we have this notion of stigma. In the slightly upmarket media, we have a certain superiority bias. Part of it is because we're upmarket. Part of it is because, well, we're not like them, back to this stigmatizing this us and the them. And so we have a headline in Time magazine. The West blames Wuhan coronavirus on China's love of eating wild animals. But the truth is more complex. Well, how more complex is it when you start to read the text? You know, have a go at those foreign tabloids, not American tabloids, not Time magazine, of course. Unsubstantiated claims about the virus originating from everything from bat soup to eating rats and live wolf pups. It's certainly true, however, that many of the Chinese are obsessive about freshness. That's a positive thing. That speaks to an American readership. Even small supermarkets commonly have fish tanks where shoppers can purchase live seafood. Eating wild animals is also considered a luxury because of their rarity and cost, much like game in the West, venison, for example. But then we slot in the context of this. Whether importer was once served slices of sashimi still attached to the carcass of a gasping fish. We slip back into graphic texts and direct experience, but are they? It's just part of Chinese culture, said Yang Hongyang. They love to eat anything alive. Well, I thought for a moment what I had found here was actually a quotation from Chinese middle class in terms of thinking about what the working class might eat. But actually, although a public health expert, the Council for Foreign Relations is actually a body that's located in the United States with a remit which is very much about the position of the United States in the world. But there was this debate in China too. There was this labelling. There was this notion of a superiority bias. Here is a blog, a Chinese blog of a woman eating about. But the mythology, the labelling, the division is that wild animals are eaten in South China. Wuhan, people from Wuhan, consider themselves not to be of the South, but to be of Central China. It's the South China people. It's the Cantonese and the Cantonese speaker, those who are different from us. They eat everything. And there's some wonderful tales at some point I might appall you with in terms of the mythology of what indeed Cantonese eaters do eat. But what we have here is that what they do does not fit our ethics about good food, about hygiene, about appropriate ways of organising our consumption. Our food customs are more civilised, scientific, and respectful of nature and of Chinese dietary ethics. A statement taken from a Chinese post. So, source of stigma, Wuhan, we thought, the South China seafood market. Wild animals, game, maybe. That eating wild animals is the transition route, and that therefore the people who eat that game are to blame. And the collective shame spreads to anybody in that category, which is the whole of South China at one level. Back to time, and back to our view of what this seafood market was like, and the language that we use. Seafood market, fine. While one side of that low-slung warren of stalls, it was a market. Markets have stalls, they're not hung, that's so you can see them, but they're low-slung and it sounds rather disrespectful. And it was no secret, everybody knew where to look. Beavers and porcupines and snakes could all be found there. Maybe they could. It's not clear as yet that there is real evidence of that, but it's part of the way we other. In China, the South was othered in those early days, but far more affecting was Wuhan, the source itself. As soon as it was recognized that this was something nasty, roadblocks were set up and anybody who had a provincial number plate was stopped officially, was stopped unofficially too. Hotels, as soon as you turned up, where do you live? Horribly, we're entirely full, a bit like the Christmas story of all the inns in Bethlehem were full because of the virus and where you come from. That's why you went in a stable, because of your hometown was not accepted in Bethlehem when you've gone. It was exactly the same in practice, in reality here. Shops with notices, don't come here, not welcome. And also this notion, if you know somebody who's from Wuhan, tell the authorities that they are there. So we had, through social networks as much as through strong authoritarian state, Wuhan became a symbol that everybody there was probably a meat eater and probably had the virus and were lethal to us, those who wouldn't do such things. And it became the Wuhan virus in the early days. It was very specific. And of course, in the global discussion, and particularly in the hands of President Trump, it took on the China virus, Kung flu, this linkage to place, and that everybody in that place is stigmatized by this disease. COVID, in those beginnings, those first few weeks, were the only weeks that consider us here in China. Very little was known. It was an unknown disease. We didn't know much about its infectiousness. When we found out, we found that it probably was infectious, that it certainly was infectious, and what's more, it was lethal. And then we found out that people didn't have symptoms but could still spread it. So you couldn't even identify them. They couldn't carry a white stick or ring a bell. They were hidden in the population. I didn't know that there were symptom-free carriers. That combined in the first stages with limited, secure public service advice, partly because the public service hadn't got a clue what was happening, partly because it was politically inconvenient anyway. We had that alongside ignorance, alongside the ability to create myth through a wide social media, and we had a mechanism that created panic and fear. There was panic and fear here in China in those early days. And so when you're afraid, you put the barriers up, you build the fortifications, the drawbridge comes up. It's instinctive, it's protective. It's a process of categorizing, keeping them away from us. Us, the innocents, who are placed at risk by them, the culprits, who are creating danger, the people from Wuhan. 2nd of February 2020, Beijing, 2 people were identified. Just think about that. Surveillance, authoritarian government can identify 2 people in a city of 20 million. They tracked them down, they quarantined 178. China abides by patient confidentiality, but not in those early days with COVID. We know that one of those was a name, we know their name, that they were a prisoner, had just been released from Wuhan's women's prison, and they were diagnosed after they arrived in Beijing. We all looked at our cell phones to see how close she had come. Likewise with a cleaner who had actually cleaned the bedrooms of more than a dozen people and caused infection. That was really close to the campus. We all looked, we all found out where they were. So that stigma brought about by fear, by risk. Stigma and behaviour comes next. Can I introduce you to Jack? Jack sleeps with me every night. The photograph was taken in my living room. You can see a certain person not wearing a mask behind Jack. So what was the purpose of the mask? Well, it makes people feel isolated from other infected people. It's therefore protective, at least in the mind. It signals a separation of me from the danger, and it helps reduce panic. If we're all wearing a mask, then we're all fighting the epidemic together. If you're not wearing a mask, you should be. And maybe it reduces the spread of the virus. I think we now, broadly speaking, accept that it does in fact increase reduce the spread of the virus. It's far from clear that that was the point of using it in the first instance here in China. But there are consequences of that. Maybe all the things on the left-hand side are right. But it also stigmatizes, of course, those who are infected. Because they must have done something wrong. They weren't wearing a mask, that's how they caught it. They were antisocial because they weren't wearing a mask and caught it. And I bet the mask was dirty. I have to confess, I find it very difficult to change my mask every time I go out. I keep wearing the same one when I wear it. So I should be stigmatized, could be stigmatized. But who were the non-mask wearers? Not typically me. We still have to pay for them. So they were the poor. They were the migrant workers, particularly after the New Year. You spotted the migrants coming back to Beijing and they weren't wearing masks. They were causing danger. Ultimately, they were criminalized for their behavior. Of course, the mask takes on a rather different view, a different position in the debate in certain parts of the West. I don't have to introduce President Trump to you. He's not wearing a mask, what is he? It's cause of some debate. It's voluntary. You don't have to do it when it was introduced as a possibility on the 3rd of April. I don't think I'm going to do it. That's leadership for you. What's the point of introducing it if you're not going to? Well, here's Trump. He's seen wearing a mask, it leaks, but he took it off as soon as he was seen. I don't want to give the press the pleasure of seeing it. It becomes macho not to wear it. It's the opposite of the use of the mask in China. And then it's used as a tool against Biden. Biden actually uses it. The softy. He's not a man like me. A very different discourse around the mask. Here in China, there were very few serious objections to wearing the mask. Maybe it was obedience to power, or maybe it's about community. Community before self, at least as a possibility. We are still very much a collectivist society here, which goes beyond the family into the clan, and the clan has no clear borders. To try and find people who broke the rules in relation to the mask, who followed Trump, oops, it's very difficult, sorry. We have to go to Australian Chinese who was working for Bayer, the German drug manufacturer. She was asked to put a mask on. She was then ordered to put a mask on. I tell you, no matter you're Chinese or a foreigner, you have to comply with the law of the People's Republic. And she lost her job. Bayer fired her for not wearing a mask. People who work for us, our employees, have to abide by local laws and regulations. I now slip from stigma to shame. The distinctions are not very clear in the literature. Stigma is spoken about mainly in psychology and public policy and social policy. Shame is more kept within the boundaries of sociology. Stigma is definitely divisive. It has internal and external components. Shame has internal, I feel it, and I am shamed by others. But in some sense, the purpose of shame is arguably different. It's about bringing you back into the fold. It's about encouraging you to adopt common behaviour, if you're able to do so. So hygiene comes into this particular case. The mask, the way it's spread, people who get it are dirty. Think about the original meaning of stigma. Back to stigma, I guess. It's back to sewage, it's back to dirt. Here we have a case of one of the early victims, we shouldn't use that word, I guess, early sufferers from COVID, picked up by the Wall Street Journal. seafood merchant in the seafood restaurant, seafood market we were talking about. She developed symptoms on the 10th. By the time she gets to the 18th of December, she's sought treatment. Cut that story short. They want her to go from the hospital that she's in to an infectious diseases hospital, where in those early days they were trying to concentrate people with the and indeed they had begun to build extensive new wards there. She didn't want to go. Indeed, she refused to go. Why did she refuse to go? Because she thought they were trying to get rid of her. They suspected market workers as being unhygienic. I thought to myself, I sell clean things. I sell live shrimps. And we have that stigma working its way through dirt back to the, and indeed getting in the way of treatment. So important is the notion of avoiding an idea that you yourself were dirty. That's how you got the disease. Concealment is certainly spoken about in relation both to shame and indeed to shame associated with stigma and illness. We compare ourselves on a daily basis about whether we're ill or well. We're in a negative environment with a pandemic, lots of social prejudice. Illness equals badness, equals bad behaviour, makes you feel shamed. Natural instinct to avoid harm is to hide one's health condition. So the shame that people carried meant that people potentially hid. We don't know how much people hid in those early weeks in China, that they didn't appear because they didn't want to be called someone from Wuhan, somebody carrying this killer. Go back to Ms. Wei, who we were dealing with before, who was selling her shrimps. She was discharged, she paid £10,000 for her medical bills, but she considers herself lucky. Some people spent so much money, they couldn't buy their lives. And in the sense of the reaction here, her sense is not so much hiding because of the shame, but potentially hiding because of the cost of treatment that might be associated with the disease. Now, it's not clear precisely what the state of payment is. Beijing, at least in June, was saying that everybody was treated for nothing if they had COVID. And that was certainly marketed, but the Wall Street Journal is citing Ms. Wei as having paid £10,000, which is $10,000, which is significant. But if it wasn't shame that held people back, maybe it was money. Maybe there was far more hidden disease than we know, not because of marshalling statistics, but because of people not wanting to expose their shame, not wanting to put themselves at risk of being stigmatized. And then shame, again, elides into blame, into blame avoidance. And there's lots of blame avoidance going on in Chinese governance. We need to think a little bit about how Chinese governance works. We see it as a highly centralized state, a socialist state, an authoritarian state, where the centre sets policy and it gets done. But central government policy is expressed in very aspirational terms. It's about setting goals. It's very poetic in its language. It's based upon 3 principles, 4 principles that rhyme and have a melody to them. Policy is interpreted at local, provincial level, right down to village level, where officials try to interpret what that poetry means in real terms. and they get evaluated on the performance of that policy. So when I was a civil servant, I filled in my annual return. It said I did my job well or badly. It didn't connect my activities to the policies that I was responsible for. That was the minister up there. Not so in China. Civil servants, frontline civil servants, carry the responsibility for the success of policy, and their careers, or lack of careers, depend on it. That was the situation pre-2011. Post-2011, the arrival of Xi as the supreme leader changes things somewhat. Everything is as pre, but we've now got performance review of local government, and we've got anti-corruption monitoring. So we've got a much more explicit policing, a much more explicit creation of the potential for fear. Reduced amount of discretion. Now you are monitored on a day-to-day basis. So you don't quite know what you're meant to be achieving, but you're being monitored against what you don't know what you're achieving, which again creates fear, fear of that monitoring. And you've got social media. So the notion that the public have no say in China is entirely untrue. They have a lot of say. So let's think about COVID, and let's think who are to blame for COVID. The Hubei famous four, if you like, the F4, party secretary, the governor, the Wuhan party secretary, and the Wuhan mayor. Where does the blame come from? It comes from social media, withholding information, reprimanding doctors who spread the message. They went ahead with a public feast when they knew. You've heard it all. But we heard it all here first, before it was, of course, picked up on Western media. It was on the social networking. So confronted with those accusations, what does government do? It seeks hard to push the responsibility up. Very unusual for local government to blame the emperor down there in Beijing or up there in Beijing as the northern capital. But it happened here. We couldn't put out the information because it had to be cleared on high. I know it's dreadful. I'll step down if to show my accountability to the public. He didn't really have to stand down because he was fired. The Hubei party secretary, the Wuhan party secretary, the Wuhan mayor, and hundreds of local officials who had anything to do with the early stages of COVID lost their jobs. What about the centre? We can make some distinction between the public health technocrats, those who were shipped down to Wuhan to take control when it was recognised that things were out of control. What did the public say about them? They're busy publishing their papers for academic journals abroad, and if you have a look at Lancet, you can see that there was an element of truth in it. They're showing little interest in combating the pandemic here or safeguarding public health. They forfeited their responsibilities and professionalism. They're playing government officials rather than scientists. They are using criteria to reduce the numbers by making sure that only people who are tested and proven to carry the virus count. And then we have blame management strategies. It's much easier. We blame them down there. We appeal to our brethren, and indeed again there's a Lancet article with scholars from the West supporting medics and scientists here in China in those early days. Disclosing more details as they got them, etc. Most of them survived. They weren't cold. It's much more difficult to get rid of a professional, particularly when you have that scientific community outside. Central leadership, not much blame directed upwards. The emperor is rather immune. sits in the Forbidden City behind the big gates, controlling the system from the beginning, holding people to account in large numbers. What about blame here? Not here in Beijing, but here in the West, as I put on my UK citizenship. And look for what's going on as we blame people, whoever, for the origins, whoever but not us, for the origins of COVID. The recent investigation by the World Health Organization was originally accepted by the US State Department. Okay, fine, we'll read it when it comes. But something like 4 days later, we had a statement released from the White House. We have deep concerns about the early findings of this investigation. We want something that is free from the intervention and alteration by the Chinese government. A major change of view within 4 days. By the 30th of March, when the final report, 140 pages of detailed analysis, was produced, it was dismissed in this joint statement, which the Brits signed up to, along with the Australians and something like 11 other countries. What's happening this week? We have an investigation into the origins of COVID, undertaken by who? The American Secret Service, to explore the hypothesis of a virus leaking from the laboratory. The story is quite interesting. The State Department was quite blasé until the New York Times pointed out that China was talking about the fact that it wasn't a laboratory leak, that it was very likely to be zoonotic transfer. So they win the public relations battle. Then the Wall Street Journal comes out with the story that China refused to release the data. How can a study be in any sense statistically valid or valid in the medical terms if there isn't the data because China hides it? Andrew Marr picks up that story, throws it at Dominic Raab, Foreign Secretary, the following day. And Reuters picks up a rather stuttering answer from Dominic Raab, who was very diplomatic in terms of not actually coming down. We share concerns that we need the right information, but Reuters carried it very firmly as Britain lines up alongside the Americans for blaming China for releasing its data. Then there was an open letter signed by a set of scientists, which was again published by the New Wall Street Journal. Scientists, yes, but organised by Jamie Metzler, who's a geopolitical expert, he calls himself. And he's linked as a fellow at the Atlantic Council. The Atlantic Council is another American think tank. His responsibility is promoting American leadership. And then, just before the report, the final report was to be considered by the World Health Assembly, the Wall Street Journal leaks again the notion that there were people in that laboratory who caught something that looked like the virus in November. And what's more, they went to the hospital. Of course, in a way, of course, they went to the hospital. I don't know whether they were hospitalized. It's very difficult to know what happened. But I go to a hospital if I have a fungus infection on my foot. I don't have a GP. So that's hardly evidence, but what are we doing? We're shifting blame for those big numbers of deaths that I began to talk about. And what about the UK? Who feels ashamed for the numbers of people who have died in the United Kingdom? Who carries that responsibility? Is it them? Is it us in terms of our behaviour? Shame becomes a blame game. So to recap, just look, just for a moment, imagine that it did leak from the laboratory. Imagine a junior technician didn't wash their hands. They had to get home quickly to pick up the child. And those deaths follow. Who is to blame? COVID-19, deliberately named to be not a place, not a country, but merely a reference to the virus and the year in which it emerged, to be neutral. In practice, there's lots of blaming gone on, followed and connected to our stories of explanation. Explanation on causal linkages, real or fantasy, but in those links are people, people who belong to groups, those who have it, those who don't, those who got it for various forms of behaviour, those who spread it for various forms of behaviour. Them, not us. They feel shame, so ashamed that maybe they seek to avoid that shame. Maybe they don't turn up. Maybe they don't tell people that they're not feeling well. Maybe they don't tell people that the policies that they considered in the first place they rejected on grounds of cost or its political impact, which takes us from shame into blame. Of course, COVID is stigmatised because it's new. It was unknown. And it's changed all our lives. And except for those who market goods on the internet, it's changed our lives for the worse. Those of us lucky enough to survive. Thank you.